Okay, welcome so much to the webinar on household food insecurity in New Brunswick. Bienvenue à notre webinaire sur le thème de l'insécurité alimentaire des ménages et Nouveau-Brunswick. So for today, we'll be doing the presentations in English. There is simultaneous interpretation being offered on the phone line, and we will be sharing out the audio from that and the slides in English and French after the webinar. So this portion is being recorded, and we hope that others will be able to access this. I think this is an important discussion. We want to make sure that we're recording this and sharing it out. So food security is a term that gets used in many different ways. It is very complex, very holistic, and it is not just about one singular issue. But the way that it gets talked about can mean different things, and that can be confusing in conversations. So this webinar series called What the Food is all about teasing out those different definitions of household food insecurity, food sovereignty, community food security. What are these different understandings? And how can we responsibly use these terms in conversation to make sure that we're actually getting to solutions? So we're excited to have two guest speakers today. They will go through their presentations and afterwards we will open it up for conversation, for discussion, question and answer period. And that is an opportunity to be able to go deeper into what they're presenting and better understand what this means in New Brunswick. Last year, there was a report on food insecurity, household food insecurity in New Brunswick that looked at the relationship between food security and tobacco use. And that was for the first time that these numbers were crunched within New Brunswick specifically. So we're very excited to have two of the authors of that report presenting today and to better understand what this means in New Brunswick and how our responses can be the right solutions. So with that, I am delighted to introduce our very first speaker, Dr. Valerie Tarasuk. Oh, now that I asked the pronunciation of your name, did I get it wrong? So my honor to introduce Val. She is a lead researcher with Proof through the University of Toronto, and really the leading expert in Canada about household food insecurity. So with that, I'll pass it over to you, Val, for your presentation.
Well, thanks very much. I'm just going to share my screen with you all. And we're going to play. Okay, good. Okay, so I'm going to try to give you a bit of an overview of food insecurity as we've come to understand it, both from our analysis of national data, but also the projects that Herb and I and some other people did looking at, excuse me, New Brunswick specific data. So to start with some terminology, as, sorry, as Laura said in her introduction, this language of food security gets used in a lot of different ways, and it's actually amazing to me as somebody who's been in the field for a long time how much these terms are getting used right now. I mean, everybody seems to know what they're talking about when they use the word food security. At the top of this slide, you see the classic definition of food security, the all people at all times with everything, right? Household food insecurity is a very, very specific thing, at least insofar as we measure it and monitor it in Canada. And so I've got that definition at the bottom. We're only talking about one thing, right? Insecure or inadequate access to food due to financial constraints. And so this is absolutely not the opposite of food security as it's defined in that broader definition. So that's important to keep in mind as we move forward. Everything I do in this presentation is going to be working with that very narrow definition at the bottom of the screen. Our best estimates of food insecurity come from a study that we've just recently done looking at data from 2017 and 18 from the Canadian Community Health Survey. So these infographics come from a report that I've got the little picture in the corner for. You can get that report from our proof website. What you can see in 2017-18, so our most recent data, pre-COVID obviously, 1.8 million households, or basically 1 in 8 households in Canada were reporting some level of food insecurity. At the bottom of the slide, I've stripped it down by levels of severity. The most extreme case, and for sure the one that is most concerning, are people who are severely food insecure. Those are people who actually reported not having enough to eat because of a lack of money. The moderately food insecure, the 5.7%, are people or households where there was evidence of compromises in quality and possibly quantity based on a lack of money. The marginal category at the end here are the 4%, are people who reported worrying about running out of food and not having money to buy more, or reported some compromise in quality. So you can see a range of severity that's captured in this 1.8 million. 1.8 million households translates into 4.4 million people, including 1.2 million children. So this is a huge problem. And those numbers have to be underestimates because the survey that all of this is based on doesn't include people living on reserves, nor does it include people who are homeless. So two groups that we know have very high rates of food insecurity. So even with those omissions, we're talking about 4.4 million people. Here's what it looks like when we break it down by province and territory, and you can see New Brunswick is not looking bad, right? Relative to a 13%, not great, but lower than any other province in the Atlantic region, and in keeping with those in Central and Western Canada. The very high rate of food insecurity, and none of it is a national disgrace. It's something we document every time there's a survey. It's terrible. Families with children are at higher risk than other families, and that in itself is outrageous. But what you're seeing in this slide is a map of the proportion of children under 18 living in food insecure households by province and territory. Now the numbers are all higher than they were in the previous slide. And you can see that we're talking about almost 79% of children under 18 and none of it. Look at New Brunswick here. Almost 1 in 5 children in the Atlantic provinces are living in food insecure situations. And that's a reasonably tight number across the country. The lowest observation is 15% in British Columbia. One of the things that was concerning to us pre-COVID when we released the 2017-18 numbers is this picture. The 4.4 million is a higher number than we've ever reported before in proof. So the indication is that this problem is festering, or if anything, it's getting worse. There have been some technical changes in the way that the survey is administered, the way that this thing is measured, that may account for some of the rise, but not all of it for sure. So we've got a big problem, a problem that we've had for a while, and a problem that absolutely doesn't seem to be getting better. Okay, that's the story nationally. Here's New Brunswick. We have 2 cycles of the Canadian Community Health Survey that are perfectly comparable, so nobody can claim there's a methodologic issue here. And here you see the rate of food insecurity in 2015-16 and then 17-18, and it's fallen by 2 percentage points. I've added these confidence intervals and these error bars, that's what these skinny little bars are at the top of this pictures, that indicate the uncertainty associated with those estimates. We're not sure that we've got the numbers right? Because it's a sample, it's imperfect. So there's a confidence interval around each one of these estimates, and that's what's being depicted in the numbers here. But so we can't, break out the champagne and say that there's been a significant reduction in food insecurity in New Brunswick yet. But for sure, the picture is headed in the right direction. And I'm going to leave it to Herb later to speculate on why that might be. One thing just to flag here, one of the really important changes over these 2 periods is the drop in severe food insecurity. And as you'll see as I talk about the nature of this problem, that matters a lot. When we look at the health of people who are living in food insecure situations, I mean, it is the thing that compels people like me to work in this area. Almost every health condition you can imagine is more prevalent amongst people in food insecure situations. Just measuring them at one point in time, they're more likely to report chronic physical and mental health problems, and that's true for children and adults. They're also less able to manage those problems, and so they're more likely to have negative health outcomes. So somebody who had a condition like diabetes, who might have been able to live quite happily for a very long time with that condition, with careful management, If they're food insecure, they're much more challenged. And that manifests in a couple of other measurements that I want to show you. The first is healthcare costs. Because people in food insecure situations are sicker than other people and less able to manage their illnesses, they're more likely to turn up in the healthcare system. What you're seeing here are data from Ontario, where we took adults, working-aged adults, and lined them up based on their food security status and simply looked at the amount of healthcare that they consumed over a 12-month period. And what you can see is a very steep gradient, right? Whereby the amount of healthcare dollars consumed by someone in a severely food insecure situation just over a 12-month period is more than double that of food secure adults. So while this condition at the end is rare, thankfully, I mean, our national number is like, what, 3%, it's a very, very damaging situation for people's health. But we also can see important differences for the marginal and moderate categories. A more recent piece of work by us is a look at mortality data. One of the criticisms of the analyses of the relationship between health and food insecurity has been that most of the data is based on self-reports. But this is not, right? Death isn't self-reported. Somebody else has to say that about you. And so what we did was link the Canadian Community Health Survey, so our backbone of food security monitoring in Canada, with mortality statistics from the federal government. And what we can see is a profound drop. We start measuring people at one point in time, follow them over time. 12 years later, you can see the survival probability for severely food insecure adults is much, much lower than it is for the others. By our best estimate, severe food insecurity shaves 9 years off somebody's life. 9 years. When we look at the causes of death, basically, they are more likely to die of everything except cancer. The strongest differentials are for infectious diseases, which is very concerning in the context of COVID, but also for unintentional injuries and suicides. But the lion's share of the excess mortality that we're showing here relates to cardiovascular disease, diabetes, metabolic conditions, other sorts of respiratory conditions, other things that are pervasive in our population, but taking a bigger toll on food insecure people. Who's most at risk? Well, we know a lot about who's most at risk, and what you see here is kind of a laundry list. Food insecurity follows other markers of social and economic disadvantage. So people who are at higher risk of being food insecure are low income, people on social assistance, employment insurance, people who are renting rather than owning their homes, with children, single parents, people who identify as Indigenous, and people with lower levels of education. And this is true both nationally, and these patterns present also when we look specifically at New Brunswick. Who's at decreased odds of food insecurity is a bit interesting, and it might surprise you. People who are reliant on seniors' pensions or retirement incomes, people who are seniors, have the lowest rate of food insecurity in Canada. The other group that we see repeatedly as being at lower likelihood of being food insecure are people who are recent immigrants. And again, this is something that kind of defies the stereotypes, but I should flag here that with the data that we have available, we can't identify refugee groups and or migrant workers that we're reading a lot about right now, and they may be in a different category. We have no evidence that it matters whether you live in rural Canada or urban Canada, and that's also true in New Brunswick. Once we take into account household characteristics like income and income source, rural residence does not connote elevated risk. And so this is the picture both from multivariable analysis nationally and within New Brunswick. The other things we've noticed from looking at national data are that there is no relationship between the likelihood of being food insecure and somebody's food literacy, their food skills, their access to gardens or community gardens, proximity to food retail. We've got nothing that's telling us that this is rooted in food issues per se. It looks like it is very much a story of socioeconomics. To show you a bit of what this looks like when it's graphed out in a prettier form, here you see the relationship between food insecurity and income. As income drops, the probability of food insecurity and the severity of it rises markedly. When we look at main source of income, we also can see huge differences whereby people who are on social assistance or employment insurance or workers' comp are much, much higher risk than others. The number for New Brunswick in 2011 or 17-18 rather, for food insecurity amongst social assistance recipients was about 55%. So a little lower than the national story, but still high. The main sources of income, though, when we take the total universe of food insecure households in Canada and we pile them up and say, okay, where are they distributed in terms of their sources of income? What you can see is that the vast majority of them are in the workforce, 65%. And that is also true when we look specifically at New Brunswick. So while people on social assistance are at higher risk, and here they are up here, there aren't that many people on social assistance, right? It's hard to get onto, and actually nobody wants to be there. So the lion's share of the problem is sitting in the workforce. There's been one study done looking at who those people are in the workforce. And this, I'm sure, doesn't surprise you. There are people in low-wage jobs, people in part-time, short-term, contingent work, precarious workers, people in households where there are many people trying to live with the wages of one. And also, unfortunately, this examination of workers reveals some issues that are hard to interpret as anything other than discrimination in the workforce. To give you a sense of how we've come to understand these pieces fitting together, and this is something that Herb is going to elaborate on more when he talks. At the root of food insecurity, we think there is a problem of income, both the adequacy of it, the amount, but also the stability or security of it, which I think is partly what's being reflected in the findings around social assistance versus seniors' pensions, for example. But on top of that, we've got this other category of assets. There are people with low incomes in Canada who aren't food insecure, and there are people with higher incomes that are. And part of what differentiates those two groups is this issue of assets, and particularly in CCHS, we can look at home ownership. Renters are 2 to 3 times more likely to be food insecure than owners. Why? Because to be a homeowner is to have an asset, a huge asset, right? It speaks to your history of wealth, but it also speaks to your ability to borrow if you need to in times of hardship. Among homeowners, those who are most at risk are people with mortgages, obviously who don't totally own their home, but also people with low housing of low value. And I think that's particularly significant in New Brunswick, where we see just a proportionately higher group of ownership amongst food insecure households, but probably people who are owning things that they can't resell in times of hardship. When we look at expenditures amongst households that are food secure versus food insecure, the pattern is kind of interesting. And again, it comes back to challenging our thinking about how this relates to food. What you're seeing here, and it's a complicated graph, but I have to be fast, you know? And so here's the breakdown of expenditures for food secure households. And here's the difference, the difference for the marginal, moderate, and severely food insecure. They're spending less. The dark red bar at the beginning is food, and you can see that the people who are food insecure are spending less on food, which makes sense. They've reported that they're having trouble getting enough food, so they should be spending less on food. But when you look at the rest of the categories, they're spending less on everything. They're spending way less on housing. They're spending less on all kinds of discretionary expenditures. They're spending less on everything. I offer you this because I think it's important to get your head around. When we talk about food insecurity, often we think, okay, people don't have enough to eat, we got to give them food. But this is, I think, the beginnings of saying, actually, they're missing more than just food. When we look at individual, categories of spending within food insecure households, we see that again. They're way, way, way more likely to report trouble paying rent or making mortgage payments. They're more likely to be defaulting on bills for utilities, for phone, for credit cards, anything that they've got a bill for, they're less likely to be able to pay it. And that makes sense, right? If somebody is struggling to afford food, they're struggling across the spectrum. They're also way, way, way more likely than other Canadians to be reporting not filling prescriptions or not taking medications as prescribed because they can't afford them. So there's been a lot of conversation pre-COVID about pharmacare and the need for universal pharmacare. Well, the people who can't afford prescriptions, many of them are food insecure people because if you can't afford to fill your prescriptions, you probably are also struggling to afford the food you need. That conversation about food is important, particularly as we ride through this COVID wave, that we're seeing a heightened investment in food charity, a heightened activity around food charity. Indeed, from the get-go, food banks have been our primary response to food insecurity in Canada. But it's never really been a very effective response. And one of the reasons is what I'm trying to display here. Now, this might shock you, but what I'm showing you here is the number of people in New Brunswick who were reported by Food Banks Canada to have made visits to food banks in New Brunswick through 2018. I'm contrasting that to the number of people by our calculations who were living in food insecure situations. And you can see that the difference is almost fivefold, right? There's almost the difference, there almost are 5 times more. I should have done the arithmetic, but there almost are 5 times more people who are food insecure than there are people using food banks. That picture is not unique to New Brunswick at all. I could show you pictures across every province in the country and they wouldn't look much different. While on the surface, food banks look like a gigantic operation. In fact, they are a gigantic operation given how much they rely on donations and volunteer labor. But this problem of food insecurity is way, way bigger. Just one little thing to try to help you make sense out of what I just showed you. This is a survey, one of the few in captivity, where people's food insecurity has been measured at the same time of their use of other coping strategies. And it was a measurement of very severe food insecurity, people reporting that they didn't have enough to eat because of a lack of money. And here's what they did. And only 20.6% were using food banks to get enough to eat. What was much more common is this one. People asking, when you think about it, that makes total sense, right? When people are having hard times, they turn to people around them. We do it. We reach out to other people in our own networks when they're struggling, and that's what goes on. People also miss rent payments and miss rent payments and other sorts of payments. But using a food bank, well, from the perspective of those who are in the general public, like the food secure, we see that as the primary response. For someone who's living this problem on a daily basis, it's not the first thing that they do. And they may not ever do it. And there's a lot of reasons for that I can talk about, but it's important to recognize that that picture I just showed you, which I'm going back to, of the disconnect, is a picture that plays out when we look at data on food insecure households. What has been shown to reduce food insecurity in Canada is income. The primary studies that have shown a reduction in food insecurity are all studies that are showing policy effects, where there's been a policy implemented that has improved the incomes of people at the very bottom of the economic spectrum. And when we see those policies, and it doesn't matter whether it's a child care benefit or whether it's an improvement to social assistance, as we saw in Newfoundland and Labrador a few years back, it doesn't matter what the nature of the policy is. If it increases the incomes of people at the bottom end of the income spectrum, we see a reduction in food insecurity. So we do know how to move the needle on this problem. We just don't have quite the concerted efforts that we'd like in terms of moving that needle. Okay, I'm going to stop there. And a word from my sponsor: if you're interested in seeing more of this, please go to our website. But I'm now going to stop sharing my screen and hand the floor over to Herb. Okay.
Okay, hopefully that's showing up all right. All right, thanks Val for that. It's always difficult to follow Val because it's like so comprehensive and like a fire hose of information. So I want to just talk a bit about why things are about to get a lot worse in the province and why we need to be thinking ahead about new solutions with respect to food insecurity. And I know there's a lot of focus on food security around sustainability of local food and access, but we're about to have a much bigger problem that's hitting much more acute. So we need to be thinking about some of the themes that Val finished with. The first thing I just want to summarize a bit about what we know about food insecurity risk in New Brunswick, and this was work we did with Val last year with support from MBHRF and social development, is that we did learn that there's nothing really unique about New Brunswick in terms of the risk of food insecurity. It's really just when you see differences in those rates across the country, it's picking up differences in the population characteristics. So if you have more old people, you're going to have a lower rate of food insecurity because, as I'll show you, we treat them very well. Val's already put that up. If we have lots of precarious, low-wage unemployed, we're going to have much higher food insecurity risk. So if we think about what's different about New Brunswick and Ontario, it's not the risk factors, it's how many people have those risk factors. And that's what we want to target, who the people are, as opposed to particular situations in the province that we think are unique to New Brunswick. It's all about income and how we choose to treat people at the end of the day. So the first thing I want to note with the new crisis of COVID-19 and the lockdown is there's a lot of things that didn't change with food insecurity risk. We didn't really change our age, our housing tenure, our marital status, our education level. So those things aren't what we want to focus on. The main thing that's changed in this crisis to show us where this problem comes from is it's disrupted how much income you're earning, and it's also severely disrupted the source of income for a sizable part of our working population. And as Val noted, most of the food insecure are coming from, in total numbers, are coming from people who are working. Social assistance, as I'll show you, is the worst place to be. But if you're a low-wage worker, you've been affected by COVID. So we know that every risk factor Val had up for who's most at risk working, they're younger, they're low-wage workers, they're less educated, they're less experienced. New Brunswick has a lot of these workers because we do tend to export our higher educated, younger workers. So we do have, at this point, an increased vulnerability to a food insecurity problem because of the COVID disruption. And one thing to note is that social assistance recipients have ironically not been as impacted, in part because it couldn't get any worse for them. But what we have seen is they're least likely to be missing rent payments because the government's continued to pay rent subsidies and things along those lines. So we need to start thinking about those lower waged workers that are about to be displaced. The other piece I want to just lay out there is there's been a lot of emergency relief, which is papering over just how bad the problem's going to be. Whether you've deferred your rent, it's going to come due. Whether you've deferred your utility bills, they're going to come due. And if you are on the CERB, which has been very popular, it will end, and then it's going to go back to what jobs are there. And even with the wage subsidy, you're probably looking at a lot of low-wage jobs that are gone, and you're also looking at much more restricted hours. So right now you have a bit of calm before the storm, but my prediction is by the fall, you're going to look at a pretty severe problem with households balancing budgets, meeting their costs. And even as landlords and everyone else start to get more desperate in their own finances, a lot less compassion for people who are struggling and having a hard time. And we're already seeing this with a fight between the provinces and the feds over the continued payment of the CERB, the emergency relief for people who have lost wage income. So if you look at food insecurity status by main source of income in New Brunswick and how we think COVID-19 is going to impact on that, on the one side, I have seniors' income, pensions, dividends, and interest. These are the real success stories in terms of food insecurity. It's a very low risk of being moderate or severe food insecurity if you happen to be above age 65, and we'll get into more why. On the other side, how bad can it be? You're on provincial or municipal social assistance or welfare, where we treat you very harshly if you need support. And we'll just show you how harshly shortly. The next best place to be is wages and salaries or self-employment with stable employment. New Brunswick has a lot of these workers, in particular coming through the public sector with good coverage of collective agreements and things along those lines. Then if you think about what's in between having the good job and being on social assistance, it's basically being displaced from your job and going on employment insurance or workers' compensation. And that's where we are right now with the COVID-19, is a lot of people who were in the waged and salaried or self-employed category have been bumped into something equivalent to employment insurance. The question coming out of COVID-19, are they going back to the more stable, that they've got their jobs back and their wages and salaries, or are we going to see them exhausting benefits and more moving on to needs for social assistance? If the government were being proactive right now, this is a big problem they should be worrying about, is what's about to happen to the needs on their residual provincial social assistance as these federal benefits run out and if the jobs don't come back. So this gets us to thinking about why a guaranteed annual income, which is becoming very popular to talk about, is becoming such a solution. And I want to point out that we know it works because we've been running this experiment since 1952, and we amended it again in 1965 for seniors. We have a lot of proof that this works. We took seniors from being one of the most impoverished groups in Canadian society, and we made them one of the least impoverished by poverty rates or even the food insecurity measure. So the old age security benefit, which is a basic income paid to all Canadians over age 65, and the guaranteed income supplement, which is a negative income tax guaranteed annual income top-up, has been paid since 1965. And this is a great program. It works effectively. And the real question we should be asking is, why aren't we extending this to more Canadians who are under the age of 65? We've already lowered the age of eligibility once from 70 down to 65. There's no reason it couldn't go lower towards 60 or 55. And Stephen Harper even recognized this when he tried to raise the age of entitlement back to 67 to save money and shift more people onto social assistance. So there's nothing magical about the age 65 in Canada, and that tells us that this is a solution that could be done almost immediately or incrementally, and we'll get into some other options as well. But this is a slide I've taken from Val because she put in the birthday cake to show that if you're a low-income person, so this is only looking at people with income under $20,000 per year who are unattached, you win the lottery if you can survive to age 65, because we're going to take you from a miserable situation. We're going to make your life better. And so when you look at this, this is the fitted likelihood of being food insecure by age from 56 to 70. And what you see is that by turning 65, you drop the risk of food insecurity in half. Now think about what that means for your health and life expectancy that Val showed you. And you have to ask, if we know this works so well, why are we continuing to allow that group below 65 carry on with this struggle? And why does it work? The red line, this is data that we had. I'm sorry I haven't updated it, but the picture hasn't changed, just some of the levels. But in 2009, if you were 65 and over, the red line shows the minimum income you would receive per year. It's a minimum income for Canadians 65 and over coming through old age security and the guaranteed income supplement. Those gray bars below, and New Brunswick is the really low one, is the maximum social assistance entitlement in the same year. So in other words, with seniors, we give you a minimum, and with non-seniors, we give you a maximum. And the gap between those gray bars in red is the bonus of turning 65. And so when you think about how New Brunswick has not been overly generous on social assistance, this is why we continue to see struggles with food insecurity, homelessness, people using homeless shelters, because we're generating a lot of it just with stinginess in how we treat people. And again, we're not talking about doing this for the entire population. We're really talking about, as Val pointed out, a small portion of the population who uses social assistance regularly. Can we do more? And if you can just even increase their income, you can help them out and make things a bit better. But as reasons I'll get into in a second, it's actually better to restructure it like we have done for seniors, to improve the predictability and smooth away some of the uncertainty that low-income households face. If you look at low-income individuals in Canada, so this is all of Canada now, we looked at what was the main source of income when you're 55 to 59, 60 to 64, 65 to 69, and 70 to 74, if you're low income and unattached. So again, this is a group extremely high risk for food insecurity. And what you'll see is that below age 65, there's some employment, but a high reliance on social assistance and EI and things like that. What happens when you turn 65 in this low income group? You go on federal pensions. You can see it turns on a dime. So this is a great experimental design because there's a discontinuity at age 65. There's an immediate change in income source, and we see an immediate change in food insecurity risk. So if you look at what happens to food insecurity prevalence by these income sources, what you see is that simply by switching off of social assistance and even employment to seniors' pensions, the food insecurity risk drops in half. So we know that this is coming as much from how you're paid your income or your income source than it is from the amount, because remember, all of these people are below 20,000. None of them are above the poverty line. So the interesting point to take away from this is that even if you don't want to give more money to low-income individuals, simply by restructuring how you give money to them can drop their food insecurity risk in half. No more caseworkers, no more scrutiny of everything, no more uncertainty, just an automatic tax-administered benefit. So if your income falls, you get the money if you need it. And so that's the idea here, is that we don't even need to increase costs a lot. We just need to do it differently, and we can do a lot of gains on food insecurity. Now, where I run into trouble is we didn't solve the problem. People are still food insecure. But I come from a school of thought that if you can make it better, why don't you start with that and then see where you can go to next? So this is an idea if you just wanted to restructure how you pay social assistance to be more like how we do the guaranteed income supplement, or taking non-refundable tax credits, making them refundable, you could do a lot for low-income households in terms of reducing food insecurity risk. So why does a minimum income help? Well, the old age supplement, guaranteed income supplement, one thing we'll note is that it's not very expensive to administer because it's simply through the tax system. You file a tax form, and if you're below, you get an extra check for that year. If you're too high, they'll figure out how to claw it back later. One estimate we had is that administration costs for these federal programs are less than 5% of the total benefits paid out. Whereas if you go to social assistance because you have caseworkers who need income, it's about 40% in the worst cases. So if all the money you've decided you're going to put towards low-income people, 40% off the top is going to pay people just to run the program. And so if you really want to help low-income people, you could say, what could we do with that money, 40%, if you just put it into benefits? The second thing is old age security and guaranteed income supplement is predictable. It's based on your age and your income, whereas if someone's on social assistance, it's based on someone's assessment of your employability and maybe how much have you demonstrated your ability to work. So there may be some uncertainty if you change your work behavior. And we've seen this for adults with severe disability. If they do start to work too much, they can wind up disentitled from their supports going forward. So they don't have the predictability. So what it tends to do is it drives them out of the workforce entirely because it's too risky to try and earn more income. The other thing we have to remember is that low income means low assets and poor access to credit. This is why the payday lenders do so well, is because when you have nowhere else to turn, 60% interest rates don't seem so bad. And so if you think about what we do for seniors, and what most of us have is we don't consume out of our current income. We consume out of something called our permanent income, which is we're allowed to smooth when our earnings come in and when we consume, either through borrowing and savings, or for seniors, we did it through old age security, guaranteed income supplement, through a guaranteed annual income. So simply by moving towards the negative income tax model, the guaranteed annual income, you can provide what we've been trying to get the government to understand as consumption insurance. And this will make a lot of the problems of food insecurity, which come from unpredictability in your budget and having to adjust your expenditure in response to surprises, either on a bill you didn't expect or sudden loss of income like during COVID. If you had some way of smoothing that, then you wouldn't have as much disruption in how much you're going to eat. So that's why this minimum income can help simply. And for my last slide, I just want to get into one of the biggest fights we've had in trying to advance the idea of a guaranteed annual income is not fighting with people who are opposed to guaranteed annual income, but fighting with people who have different visions of what kind of guaranteed annual income. So I've been talking about what you would call the more Milton Friedman negative income tax efficiency type perspective. It's not paid to everyone. It's paid to people who are demonstrated on a tax form to have too deficient income. This is competing with a different vision, which is a universal basic income, which is everybody gets an annual payment per year, much like the old age security benefit if you turn 65. So to contrast it, the universal basic income people would likely argue, get rid of guaranteed income supplement and just enrich the old age security benefit. My preference would be to eliminate the old age security benefit and enrich the guaranteed income supplement, make it all more income tested. Why would I propose that? Because not everyone needs a basic income. So there's an important symbolic gesture to it. There's a social justice dimension. But if you really want to just be pragmatic and help the low-income groups that are generating a lot of society's challenges, when you do something like a basic income, you're taking a high cost program and you're spreading it like peanut butter across a lot of the population that don't actually need it. So if you move towards more of a universal coverage of the population through an income tested guaranteed annual income, then you're targeting your benefit and you have a chance of making more of a dose to those who are more in need. And this is also a model that's more practical to implement because it doesn't require fundamental rewriting of all their programs. For example, Alberta simply took their income for the severely handicapped program and structured it along the same lines as old age security and guaranteed income supplement. It didn't require any constitutional change. It didn't require any big bang changes. You had a group that you identified as in need, and they just created a guaranteed annual income. So same budget for the higher benefits, and it's much simpler to do if you start with targeting and then try to spread it out. So it becomes much more of a make your changes on the pliable margins where the public is willing to do it, and then allow it to spread, as opposed to starting with we have to do it all at once, which always gives a government a reason to say no. And so this is also why I think piloting in Canada is so popular, because you can promise it's small and it may stop if people don't like it. And we want to move away from piloting. We want to get into implementing. And so there is a new, apparently, area in universities coming in called implementation science, which would probably take on this question of, do you want basic income or guaranteed annual income, if your goal in the end is the same, which is to improve the well-being of the most vulnerable in your society. And my last pitch is, if you like our current social assistance system, then you would really love living in the 19th century, because it's really one of the most, one of our best preservation of heritage that we have. It's carried forward, it's resilient, and it hasn't worked for 160 odd years that we've been doing this. So let's try something else.
I sense a bit of sarcasm there, Herb. So thank you so much, Dr. Herb Emery, Professor of Economics and Vaughan Chair in Regional Economics at the University of New Brunswick. Together, Val and Herb have worked on household food insecurity measurements in New Brunswick. And so this is very important research to be able to enlighten our work here in the province. Thank you both so much. I would also like to give a big thank you to our simultaneous interpreter. This was probably among the harder jobs for him. So much information, so much complexity of information to come by. So with that, I'll complete the recorded portion, the presentation portion of the webinar. So thank you both, and thank you to everybody who's participated.